Okay, happy Monday morning, everybody. I can't believe this wind. Oh my gosh. My stepson has a hockey net out front, and I thought, maybe I better go get that, or I don't know where it's going to end up with this wind. It was being blown all over the front yard. So anyway, thanks for being here so early this morning. It's not too early, but feels like it with the cold. My name's Kristen Abner. I am the client manager. I work with Kimberly for Community Action Partnership. I've been there for a number of years, and I've worked in Health America for 23 years. So you're probably thinking, okay, she's with Health America, but we've got a bunch of Aetna stuff in front of us. So this is my packet. This is Aetna on the front of it. We were acquired by Aetna in 2012. Much to my surprise, a friend sent me a text message at like 7 in the morning, and we were acquired by Aetna. So that's a pretty big deal. We were a national company, Coventry, and Aetna bought everything. And so since then, we've received the required approvals that we needed for Aetna to acquire us. And then we've been transitioning other states in the country to the Aetna platform, and now it's our turn in Pennsylvania. So I've been working on this year, and the bulk of my groups are January renewals, such as CAPAs. So we're moving the benefits to the Aetna platform January 1st. So what does that mean for you? When I transitioned to my Aetna benefits, which was 2014 in January, so I've had Aetna benefits for a while. I got a new ID card. I had a new website to go to. I had a new customer service number to call. If I had any questions and I wanted to talk to a representative. And that's, it was pretty much it for me. I mean, the formulary, same formulary. We're moving our clients to Aetna adopted our pharmacy. Does everybody know what a formulary is? I'm going to talk about it in a little more detail, but it's a list of approved medications. So the medications should be the same. I haven't had anybody complain about that as of yet, and I've transitioned quite a few groups over. So Aetna had hundreds of formularies, and they liked the way our formulary was and managed, so they adopted our methodology. So that's really good news as well. So in your packet of information, there's a plan design. If you've ever looked at the Health America plan design, this looks a lot different. It's the Aetna plan design. It's got a number of pages. Health America's used to be a one-pager, front and back. This has some staples. It goes into your covered benefits. There's some exclusions that are listed. There's a lot more information on here. A lot of preventive services that you have available to you for no out-of-pocket expense, so make sure you're getting your preventive services. But this is you have a point of service plan. If you're into health insurance and acronyms, you've had a PPO, a preferred provider organization. Up at the top, Aetna refers to the plan where you can go in and out of network as a point of service. When you stay in the network, which means you have services rendered with our contracted physicians, you have lower out-of-pocket expenses. When you go outside of the network, you have higher out-of-pocket expenses, and you can be balance billed. So it's definitely to your advantage to stay in the network. Does anybody know how you can know if your provider's in network? Confirm that they're in network before you go. You call customer service and look on the website. We have the same network that we did before. It's actually a little more robust because we were able to add some Aetna physicians that we didn't have contracted under Coventry, and we filled in some holes for them as well. So it's a more robust network with Aetna. Which is a really good thing. But I do always caution people to make sure your providers are participating. Doctors can opt in and out of networks on a daily basis. We don't print directories anymore because it's like the phone book. As soon as you print it, something changes in it, and it's not accurate. So look online, call customer service if you have any questions about provider participation. So your benefits have not changed from last year. That's really, really nice for me to stand up here and say. I don't have to tell you that your deductible is increasing or that your copays are increasing. So you have a $250 deductible that you have to meet, and then you don't have co-insurance on this plan, which is, again, really nice. I have a $5,000 deductible. So before I can access the benefits in my health plan, I have to pay $5,000 out of pocket. So wow. So yours is $250 for an individual, which is really nice. We do have copays for primary care visits that are illness or injury, specialist visits, urgent care, emergency room copay. Yes. Just want to make sure I'm saying that right. Yes, emergency room. So you do have some copays, but Those copays you would have access to before you actually hit the deductible. So if you go to your primary care provider and you have a physical, it's your annual, and you remember me saying there's no out-of-pocket expenses, and you get a bill, and you're thinking, well, why did I get a bill? Did that ever happen to anybody? You go for your preventive services, and you think it's not going to cost you anything, and you get a bill in the back end. That happens because the provider determines that during that visit there was something, illness or injury. Maybe you brought up something that was in addition to going for a physical. Maybe you have a suspicious mole that you want to take a look at. Or, you're not feeling well, you're feeling maybe depressed, or you've had a sore throat, something nagging that's just not going away. Or sometimes your doctor at the end of the visit will say, so what else is going on with you? And that's just like an open door for you to be, oh my gosh, there's so much going on. So you may get a charge for the illness injury part of that visit. And then the preventive would be the no out-of-pocket expense to you. So I always ask my doctor when I'm leaving my physical, am I going to have any out-of-pocket charges that I wasn't anticipating? This is my physical, but is there anything you're going to code differently than preventive? So I know if I'm going to be made to pay for some things out of pocket. Okay? Okay, great. So in addition to your plan design, you also have a summary of benefits and coverage in here. This is required by healthcare reform. The government requires your employer to give these to you. We create them and really gets to hand them out. They're in my packet, so we're hitting on the people that came to the open enrollment meetings. But this is another look at your benefits. The first couple pages are specific to your benefit, and then a lot of the other information, there's some definitions, some compliant things that telling you your plan is doing. This is required by the government because if you have the opportunity to maybe hop on a spouse's plan and they're with one of our competitors, their plan design is going to look a lot different than this. And if, health insurance to you might be like car insurance to me. It's really confusing. I called my State Farm agent, and I did a couple weeks ago for my son's car insurance, and I said, you have to break it down for me. It's really, I don't deal with it every day. Like you don't deal with your health insurance every day. So this will give you the ability to look at a spouse's plan because they should get one of these too. You put it side by side, talk about your premium contributions, look at your deductible copays, they have co-insurance, and decide which is the best plan for you to take. Okay, does that make sense to everybody? Okay, great. All right, this is kind of the fun part for me because I can honestly say since we were acquired in 2012, a lot has not changed. We were acquired by a large global company that is very technology innovative. They have an awesome website, and ours has kind of just stayed the same. Our programs have really just stayed the same. So I'm really anxious to be able to talk to you about some of the things that we're able to offer with Aetna effective in January. So this flyer talks about pretty much what I talked about to begin with. What can you expect transitioning to Aetna? And if you flip the page, you'll get a new ID card. So make sure Kimberly has your right address because we want to make sure that ID card gets to you for January 1st. It's a family ID card, so if you would have a spouse on the plan or their dependents, I know a lot of you don't at CAP, a spouse would get a card, dependents are listed on the card. If you lose your card and need another card, you can call customer service, or you can log on to Aetna.com, the website, and right in the middle of the screen, it's really easy to see, or on the left-hand side of the page, it'll say member ID cards. So you click on that, click that it's for you or whoever it's for. It'll show you a PDF of that card, and you can print it. You can take a picture with your phone, or you can use a couple of the mobile apps I'm going to talk about to pull the information up if you need to give that to your provider. The next page talks about the explanation of benefits, an EOB. I don't know if you've ever gotten one of these in the mail, but if you've had member responsibility other than a copay, which you've had zero co-insurance, but your deductible dollars, or maybe you went to the doctor and something wasn't covered, you're going to get an explanation of benefits to explain what your member responsibility is. So have you ever gone to the doctor and you get a bill from your doctor really quickly? Yeah, they like to bill you really quickly. Sometimes it'll say this is not a bill. But some people don't even see that, and they go ahead and pay. And you might be paying too much, because remember I talked about providers, and we have contracted rates with those providers. Provider's not going to bill you what the contracted rate they have with us is. They're going to bill you their high charges, and we might pay half of that, and that's what your member responsibility is driven off of. So you don't want to pay the provider until the claim goes through our system and we process it, and you understand what your member responsibility is. So let's think about this. You have a $250 deductible. If you've already met that deductible for the year, but you go to the doctor and it's a $500 service, he sends you a bill for $500. Based on what I just said, are you going to pay that when you get his bill? No, you're not going to pay that. Good. Good. You must have had coffee that you're actually paying attention. No, you're not going to pay it. I said you've already met your $250 deductible, so you don't have any more out-of-pocket expenses. You might have a copay for that visit. But if there are other services related that aren't driven or a copay isn't applied, you're not going to be responsible for that entire amount that he's billing you, because it's going to run, the claim's going to run through our system, and then we're going to send you an explanation of benefits so you understand what your member responsibility is. Then he's going to send you a corrected bill that is reflective of what we paid, and that's what you should go ahead and pay. And if you ever have questions before you get your explanation of benefits, or even after, just because there's a lot going on in an explanation of benefits, you can always call customer service and they can talk to you about that. Same with that preventive visit. If you get balance billed and you're not expecting it for your preventive charge, call customer service and ask them how the provider billed the claim, because they can explain that to you, and if you disagree with that, then you can call the provider and you understand how they billed it, and you can have an intelligent conversation with somebody at the billing office to understand why they coded the claim that way. So don't pay your provider as soon as you get something in the mail from them. Aetna Navigator, that's just a techie term for our website. It's just Aetna.com. And as I said, there down the left-hand side of the page, there are, it doesn't show a screenshot in here, but left-hand side of the page and across the top, just like any website, a lot of frequently used sites, areas you want to go to that are very commonly asked questions. But Navigator, I suggest you log on and check it out. Probably, has anyone ever gone on Health America's website? Ask this question, and I know many people don't, so that's good that you have. But I really like Aetna's website. There's a lot of great information. You can compare drug costs. You can check out the Member Payment Estimator tool, which this flyer is in your packet. This is the tool that helps you comparison shop, like you might for your coffee, or you might for Christmas toys, or shampoo. I don't know. I comparison shop for everything. I don't want to pay more for anything than I have to. And this tool lets you do it. It's right in the middle of the page. When you log on to Aetna.com, there's a little link. You click on that link, and it lets you pick from, I don't want to say thousands, I don't want to say hundreds, because it's a lot. There are a lot of services you can pick from. Diagnostic services, surgeries, high-end radiology services. Your doctor says that you need something. You go into the payment estimator, click on the type of service that he's suggesting you have rendered, put in your zip code, and it'll bring up a list of providers and the associated costs for those services at different places. Does anybody think services are more expensive at a hospital versus a freestanding facility? Does anybody know? It's really expensive to have things done at the hospital. I'm not going to pick on Lancaster General, but any hospital, it's really expensive. So this tool allows you to comparison shop. So if you go to your doctor, you're having some, pain in your back, which I have, and I've had back surgery. They might send you to the hospital to have an MRI, and this tool will let you see what and it actually bounces it against your benefit plan. So if you've already met your $250 deductible, it's going to show you that you're not going to have any member responsibility for that, but it's also going to show you the contracted rates. Community Action Program Partnership actually processes or pays your claims. They're a self-funded employer, and you want to keep costs down, even though you've met your deductible, and you might be thinking, oh, well, I've already met my deductible. This isn't going to cost me anything out of pocket, but it will increase costs for a community action partnership, and you want to be good consumers of your health care and not drive those costs up, because it affects your contribution that you pay, and the better utilizers of health care we are, the less we'll end up paying. So this is a really great tool. The Informed Health Line, has anybody used Health America's Nurse Line? Did you even know you had access to it? There's a number on the back of your ID card, and it's a 24/7 nurse line that you can call. And you can, I hate to say free, the government likes to say, go get your preventive services, they're free. Is anything free with healthcare reform or anywhere? I mean, nothing is free, we're all paying for it. But this is a service that you do not have any out-of-pocket expenses for, and Community Action Partnership doesn't either. So if you have some symptoms, you want to talk to somebody medical, you don't want to Google it, which most of us do. We run to our computer or our iPhone and Google something when there's something wrong with one of us or our kids. You can call the nurse line and talk to a nurse about it, and they can give you suggestions on how you can treat it, or they can suggest where you should go for help. Whether your primary care physician, make an appointment with a specialist, go to the emergency room as quickly as possible. It's a great service. That goes away 12/31, but Aetna has the same service, so it's called the Informed Health Line. But it's Nurse Line 24/7. The number will be on the back of your new Aetna card when you get it. So just don't forget that you have access to this. It's a really great program. That's why I like to not do open enrollment meetings, because people don't know this stuff. So iTriage is an app that you can download on the App Store today. There were physicians that created this app years ago, and Aetna purchased it and made it their own. So once you have an Aetna username and password, you can log on. But without that, you can download it as well. And when you do, it'll ask you if you're male or female and some other gender information, your birth date, I believe. But when you click over here, it says symptoms. It'll pull up the anatomy of a male or a female, depending on what you are. It's like this. And if you're having elbow pain, you press your phone on the elbow, or shoulder pain, or back pain, or headaches. So it'll bring up a list of things that could be wrong with you in that part of the body. Then you click on what you think it is. Then it'll give you ways to treat it. And once you're a member, you can keep clicking, and it'll show you participating providers that you can go to feel better and how to get there. You can pull up your member ID card. So it's a really cool app, and that's how you can kind of make it your own after you have your Aetna information. And this is another app. You can pretty much do everything on the app that you can do while you're sitting at your computer, including that member payment estimator. It's at the App Store, and the back has a screenshot of some of the things that you can do. Really, just about anything you can do while you're sitting at your computer, you can do from the app. So you might want to download this. Did I say you can pull up your ID card? I did. You can.
I'm pulling up iTriage right now.
Yeah? Yeah, I have it. I usually, well, if I remember, I have my phone out and I show you, but it's very user-friendly, and it's nice that you can look up those participating providers and urgent care facilities. It'll show you the participating hospitals, which they all are, but it is a great app. Teladoc is I love this. This is the favorite part. This is my favorite part of my presentation, because I think this is like wow. Teladoc is a service. I talked about the nurse line, but Teladoc is a service that you can call and talk to a physician. And 24 hours, 7 days a week, these physicians can actually prescribe medication. So, let's say you have pink eye. If you have pink eye, do you know you have pink eye? Yeah, you definitely know you have pink eye. Instead of going to your physician, you can call Teladoc. You'll get information in the mail, probably a little after January 1st, maybe before. I don't know. I can't order it for you until some things are done in our system with your benefit plans. But you'll get information with the number, or you can get to it from Aetna's website. I put the number in my cell phone. You can call Teladoc to talk to him, or you can FaceTime with the doctor. And you talk to somebody who registers you first, and then you hang up with that person, and then a doctor calls you probably within 2 to 5 minutes, maybe less. I used it 2 weeks ago, and I think they called me in about 60 seconds, but I don't want to set expectations too high. So I told him what symptoms I had. I already knew what I had. And he said, yeah, this sounds like what you have. I'm going to prescribe this medication. And I told the rep that I spoke to, first of all, what my pharmacy was. So I said, well, that's not normally what I take, and then what I take usually works really well. And he explained why this med might be better. And I said, okay, I'll try it. That's fine. And it worked. I felt better in about 24 hours. The charge for this is your primary care copay. It's a $40 charge, but CAP picks up the extra $20 to get to the $40 payment. So it's really nice. I remember I said that CAP is paying for your claims behind the scenes. So if you go to a doctor for a preventive or illness or injury visit, it's probably about $80 for the visit, and then whatever else he does. I know you're always going to have your copay, but remember that CAP is paying for those services behind the scenes. So we're trying to keep costs down. I'm not saying don't go to your doctor, because we do want you to go to your doctor. I'm really busy. It's hard for me to break away, especially this time of year. I knew what I had, and I thought, I want to try this, because if I try it, then I can talk to you all about it better. And I can't say enough good things about this service. It worked really well. I used it in March for my son. He had a much more serious accident. He fell off of a rechargeable skateboard with a remote control. It was 11:30 at night. He was in his neighborhood. He lives in Chicago, and it worked really well. I was actually in Chicago in a suburb, and I couldn't get to him right away, and he wanted to go to the emergency room. And remember, I said I have a $5,000 plan, and the way my plan works, I don't have a copay until I hit my deductible. So it probably would have been, the emergency room is really expensive. Has anybody ever been in the ER? It's like $800 to walk in the door. His knee was bloody, his shoulder, he thought he had done something to his collarbone, and he did. I'm thinking it probably, Chicago would have been like a $2,500 or more ER visit. So we called Teladoc. My plan again, I had to pay the $40. Then we went to urgent care the next day. That's what they said. Ice it, pain meds, try to get some rest. By the time you get to the ER and you're seen, it's going to be 4 in the morning. Another 4 hours, urgent care is going to be open. So it calmed him down. We got the pain meds in him, and we went to urgent care the next day. So, it's not just for colds, flu, ladies' urinary tract infections, because men can get those too, but I think women are more prone to them. Bronchitis, all of these things that we're going to start experiencing now with the weather change. Don't forget that you have this service available to you. It's awesome. I love it. The other thing that I failed to mention when I was talking about formulary is that health insurance companies work with pharmacy benefit administrators, PBAs, and they do a lot of things behind the scenes. Does anybody know what the pharmacy benefit administrator is today with Coventry? Has anybody gotten anything in the mail about their pharmacy? Well, it's Medco or Express Scripts. Express Scripts acquired Medco several years ago. Occasionally they'll send you information in the mail. You could be taking a different medication and saving money, or maybe there's been a change to the formulary in January and July, and that will continue. We add and delete medications to the formulary. So if you're on something that's maybe being deleted from the formulary, you would get something from the pharmacy benefit administrator telling you it's coming off formulary. You're not going to be able to get it anymore unless you pay the full cost. But here are some alternatives, and we're going to notify your doctor as well. The pharmacy benefit administrator for Aetna is CVS Caremark. So when I say that, you're thinking, oh, geez, is that where I have to go to get my medications? No. You can still go to any participating pharmacy to get your pharmacy program, but CVS Caremark is the pharmacy benefit administrator behind the scenes. So if you get something from CVS, don't think it's their junk mail and you throw it away. There could be something in there that's related to your RX plan, to maybe a medication you're taking. So I just want you to be looking out, for things that are coming in the mail from CVS. I'm ordering a special card for you. It's a loyalty card, but it's an Aetna loyalty card, and you get 20% off their CVS products, which is nice because they're less to begin with. I use the contact solution. So it's less than the name brand, and then you get another 20% off. So that will be coming. It will say CVS, probably in January. Don't throw it away. If you have an existing loyalty card, you can transfer on their website everything from that number to the new number that you'll have. I've had mine for years, and I just didn't want to lose all my points. So it was really easy to transfer. Does anybody have any questions? For mail order delivery, for pharmacy fills, everything's going to transfer over. You're not going to need a new prescription. If you have an expired prescription or one that doesn't have any refills left, of course you're going to need to talk to your doctor. If you would rather use retail instead of mail order, you can pick up your maintenance medications that you might be getting through the mail today at retail. but it's 3 times the copay. So there's no copay savings when you get your medication at retail. I like to do it. I don't fool with the mail. I don't know why. I'm on one medication, it's $3 a month. I'd save $3 if I did it, but I'm in CVS, always looking for coupons and deals, so I just get it while I'm there. Does anybody have any questions? I think I hit on everything.
What is co-insurance?
Co-insurance?
Yeah.
Co-insurance? Co-insurance is what you would pay if you had co-insurance after you hit your deductible. So your deductible is $250. A lot of my clients have 80-20. So your insurance pays 80%, and then you would pay 20%. So you'd have your $250 deductible. So let's say you met your $250 deductible, and then just to make it easy, let's just say you have an MRI. Doctor bills $2,000. Are you going to pay that? No. Good. You guys are listening. Yay. Don't pay that $2,000. Let's just, to make it easy, say it was $1,000. And let's just say you had 20% co-insurance, but you don't. You already met that $250 deductible, so you would have 20% of a charge on that contracted rate of $1,000. So you'd be responsible for $200. You don't have any co-insurance here, though, so that's
I just always hear that term and I never understood what
it's like me and my car insurance, you hear it, but I don't really understand it because, fortunately, knock on wood, I don't use my car insurance that much. So, but that's what co-insurance is. It's after you hit your deductible, you're able to get into the plan, and you're not paying all of those first dollar expenses because that's what a deductible is. So, but yeah, you have a really very nice plan here at CAP. But good question. Okay. All right. Well, I'll be here. Sue Ellen is going to talk to you about some other things with your benefits, and if you think of anything, let me know. Thank you.
You're welcome. Thanks, Kristen. I'm going to be going over this other booklet that you received. This is just an employee benefit guide. It has a little summary of all of your benefits. So there's just a very brief summary in here of your medical, dental, vision, all of the benefits that you have. Right now, this is your open enrollment period, so you can make changes to your benefits if you want to right now. This is the only time that you can do that, so if you want to add benefits or stop them or add dependents or things like that, you can do that now. If you want to make any changes, you need to complete some paperwork, and that needs to be in by December 9th. Normally during the year you cannot make changes. Whatever you have right now will roll over into January if you don't make any changes. They will start January 1st and run for the calendar year, and you can't make changes unless you would have something called a life event, which would be something like getting married or divorced or having a baby, losing coverage with your spouse or something like that. If something like that would happen to you in the middle of the year, then you can make changes, but you need to let really know within 30 days of that happening to be able to make changes. Okay. I mentioned there's some information on your new Aetna plan and the medical plan in here. I'm going to skip over that since Kristen did a great job of talking about all of that and move on to page 4, which is your flexible spending account. You've probably already received emails about the flexible spending account. This is something you're already in an enrollment period for that. The IRS says you need to elect this every year if you want it, and you do have to have those forms in by this, I believe that's this Friday, the 23rd.
For the flexible spending
Wednesday,
account, yes.
Whatever the
That's
23rd is.
Wednesday.
Yeah, Wednesday.
Flexible
Short week for the flexible spending account. So what is a flexible spending account? Flexible spending account is an account you tell us how much money you want to put away for next year, for calendar year 2017, and then you can use that money to help pay towards your deductible, your co-payments, towards dental expenses, vision, anything that's not covered by the insurance. So things that you would have to pay cash for. Why would you want to do that? It's a pre-tax benefit. So you're allowed to put it up to $2,550 in throughout the year. It would be divided over your paychecks equally throughout the next year. So say you decide you want to put $1,000 in for next year, you elect that. It'll, like I said, it will be come out of your paycheck equally throughout the year. But If you're in a 20% tax bracket, you're saving 20% or $200 of that $1,000. So you still have $1,000 to pay for your deductible, your glasses, whatever. You have $1,000, but maybe only $800 is coming out of your paycheck. I mean, that's going to depend on whatever tax bracket that you're in. To you, you're still have to pay for your medical care, but you get the tax savings on that. Right? That account, something I do want to caution everybody, and this is what always scares people, is the use it or lose it rule. This account, you do have to use it in the calendar year 2017, so you have to have services in 2017. And again, I said that's for medical expenses, dental, vision, anything that's not covered by insurance. So it's a good way to save money. Do budget your money wisely, what you're going to put into it. Maybe every month I take a certain medication and this is what it costs. Maybe you need blood work every quarter, you know what it costs. You get glasses every year and you have a little out-of-pocket expenses, or the children needs braces next year, or whatever. If you have some known expenses, this is a really good way to save money for that. And again, you save the taxes on that. You also have access to a dependent care flexible spending account, and that is for you to put aside money to pay for daycare while you work for your children. So, and that's up to $5,000 if you're interested in that. Again, you save the taxes on that. You still have that money to pay for the daycare, but you save taxes, so you can have big tax advantages to these two accounts. And again, you should have emails and forms talking about this. Again, they're due back Wednesday for the flexible spending account only. Okay. All right. I'm going to go over just a brief summary of some of the other benefits that you have here at CAP. The dental, you have dental insurance. That's continuing the same as it is. It's through Guardian. Guardian is your network. Employees are eligible for this after 1 year of service, and CAP provides this to employees at no cost to you. When you have dental insurance, you have 2 different networks here to choose from, and there's different levels of service for the different dental procedures. You also have out-of-network coverage here on this side, and just something to talk to you about, like preventive care. It says it covers it at 100% no matter where you go. Preventive care is things like your cleanings that you get, maybe twice a year. If you go out of network, it says it covers it 100%, but they're going to pay similar to what they pay their in-network dentists. So you might end up owing more if your out-of-network dentist charges more than what they would normally pay an in-network. Again, there's discounts and things like that associated with dentists too, just like with your medical. So, if you can stay in the network, you get the best benefits. Where it says 100%, they've already agreed to that payment, and they won't bill you any additional money. Okay, vision insurance. This is another benefit that CAP provides you with after you've been here for a year. You're enrolled in the vision insurance, and there's no cost to you for the vision. It's through VBA, Vision Benefits of America. That, again, is your network, and I'll say it again, you get the best benefits if you stay in the network if you can. Your plan provides for vision exams, lenses, or frames every 12 months, and when they say 12 months, they mean 12 months, so it's not a calendar year benefit. It's every 12 months. So if you went March 5th this year, you're not eligible for benefits again until March 5th next year. So keep that in mind. You go on March 1st, they're going to say, sorry, no coverage. Now, I know it's just a day, a few days, but they do track, it goes, but your benefit is every 12 months. And you can call into them or look online to see when you're eligible for benefits if you don't have your receipts from last year. You'll see a lot of things are covered at 100% as long as you stay in the network. I do always like to point out frames. It's 100%, but it's 100% of a specific allowance. So if you buy frames that are $500, it's not going to cover it 100%. You're going to have to pay some of that. So that's, if you do that every year, that's a good way you should set up the flexible spending account to help pay for your glasses and save the taxes. I mentioned you do have out-of-network benefits with the vision. This works a little bit differently. Out-of-network, you have to pay your eye doctor or whoever you're getting the glasses from or whatever. You have to pay them up front, and then you'll submit a claim form to VBA, and they will reimburse you. They'll give you money back towards their service based on this schedule. Your plan covers either glasses or contacts during that 12-month benefit period, not both. So you need to look at, if you wear both, which one gives you the better benefit for that, with the insurance. Okay. Just some more reminders, really, of the more benefits that you have here at CAP. You have basic life insurance, 1 times your salary, and I bold it here to check your beneficiary form, so it's a good time of year to make sure you have who you want to as your beneficiary. People get married or divorced or whatever, so just make sure that's up to date. It's a good time to check that. You also have disability benefits that are, again, these are no cost to you. So if you were sick or something happened and you have to miss work for a period of time, you have access to disability benefits for up to 26 weeks for short-term disability, and then long-term disability. That actually covers you up to retirement age if you're still disabled. So that's a way to continue some income to you if something would happen to you.
And long-term disability is for exempt employees.
Okay.
I believe it states there.
Yeah, yeah. Okay. All right. Page 8 is another benefit that you have. You may or may not know that you have this benefit, but it's a really good benefit called Connect Care 3. Connect Care 3 is a patient advocacy service for you. This is something you choose to use if you need. You need to make a phone call to use this benefit. Patient advocacy, these are registered nurses that are there to help you through any kind of medical situation you might be having. So say you get diagnosed with something, a lot of things go through your mind when you get a new diagnosis. Oh, what do I do? How's this going to affect me? Who should I go see? What specialist? You can call Connect Care 3. And these registered nurses, they will help you through the process. They will talk to you. Here's questions you should ask your doctor, to understand. Because they are local in this area, if it would help you, they would even go to the doctor appointment with you and take notes and type it up for you so you can understand. If you need information, how do I take the medicine? Or if you need, how do I need hip surgery? How do I find a specialist? Who's the best specialist out there for that? You tell them how far you're willing to travel. You just want to stay in Lancaster, or is all of Pennsylvania open to you, or what? And they'll find the best doctor for you for that. So they're there to work for you. You do have to make a call to them. So they're not going to look at your claims, or they're not going to reach out to you. So if you would ever need them for any reason, to find someone to help you with a medical situation or just to give you more information, it's a really great service. Next page, these are your payroll deductions for your medical plans, and these did not change at all this year. So you have great medical coverage, you have great benefits here, and no change to your payroll deductions as well. We don't say that about every employer, so most are experiencing big changes. Another resource I want to make you aware of is a member care associate. This is Janira Santana. She is in my office, and she is there to help probably more after the fact with a claim. If you get a claim, say it's one of these preventive bills, you get a bill, these exams that there's no cost for, but then you get a $200 bill, you don't understand it. You can contact Janira directly, and she can work with Aetna or your health care provider. Maybe it was coded wrong, and she can help them to get it reprocessed and paid. Maybe it wasn't, and maybe it's something you're gonna owe. I always say she can't make every bill disappear, she can't get everything paid for you, but she will research it for you, work with your, provider and your insurance company, and to find out, how the process, what went, how it's supposed to be, and she can talk to you and explain it to you, what that outcome is. Down below, there's a long list of contact information for all of your providers. I talked to you, stay in network. You get better benefits if you go in the network. You have discounts in the network. So you can call customer service for your various benefits. You can go on websites, put in a zip code to find the providers you need. So all that contact information is here. Some of the things Kristen talked about, the nurse line, contact information's here, the patient advocacy service, Connect Care3, and Janira's contact information. So lots of information here if you ever need to reach out to anybody on your benefits. All right, the rest of the packet, a lot more required notices for you. So I'll leave these to you to read tonight at bedtime. That's all I have on the benefits. So does anybody have any questions on anything I talked about, Kristen? And again, we'll be here after the meeting if you want to talk personally.